Welcome to our sonography lecture on renal pathology, part 2 of 14, evaluating renal masses for the sonographer. This lecture will cover identification and classification of renal masses. So renal masses are categorized as cystic, solid, or complex in sonographic terms. When we are evaluating the kidneys, ultrasound is very strong at evaluating cystic masses. And cystic masses, when we see them, they exhibit smooth, thin, well-defined borders. They are typically round or a little oval-shaped. There should typically be a very sharp border or interface in between where the cyst sits and the renal parenchyma. They are anechoic, meaning there are no internal echoes. And we should also see posterior acoustic enhancement, or that brightness kind of behind where the cyst sits. Solid masses of the kidneys are going to exhibit more irregular borders. They're going to have poorly defined interfaces between the mass and the kidney, commonly because the mass is growing from the kidney. They're going to have low internal echoes, so they're going to be probably more on the hypoechoic side with some definite solid components within. The posterior border of the mass is typically poorly defined because the mass attenuates the sound as it insonates the area. And there should be no through transmission, so there will be no brightness behind the solid mass. Complex masses then are kind of a combination of the cystic and the solid mass. They're going to show both characteristics of these lesions. Within the complex mass then, we may see areas of necrosis, which means death of tissue, hemorrhage, which means bleeding into the tissue, abscess, which is an infectious collection within it, or calcifications, which show up as bright echogenic foci within the mass. Now, the Bosniak cyst classification helps us to standardize care of cystic renal findings. And what that means is that when a patient comes in for an ultrasound, one of the most common things that we're going to see via ultrasound are cystic structures. Now, when we see those cystic structures, we'll take pictures of them, send them to the radiologist, and they can use the Bosniak cyst classification to decide what care does this cystic structure need. Now, we know that most cystic structures are completely benign. They are nothing to really worry about. They just contain this very innocuous cystic fluid within them. Patients have them all the time. No big deal. The Bosniak cyst scale is going to look more at what does that cyst look like? Are there internal components? Is there anything concerning about the cyst? And then again, it's going to standardize the care that this patient receives. So here's the Bosniak renal cyst classification system. The lower on the scale that you are, the more likely it is benign, unremarkable finding. So a Bosniak cyst scale of 1 means that it is a simple cyst. Again, we have thin walls, through transmission, anechoic. 2 on the Bosniak renal cyst classification system means that there are going to be some septa, so maybe some lines of tissue running through the cystic area. There might be some small areas of calcification along the septa or along the wall of the cyst. And there's going to be more attenuation behind the cyst. So the enhancement or the through transmission is not as apparent. Now we can step that up to a level 2F, meaning now we have the same characteristics as a level 2, but now there's more septa, or they tend to be a little bit thicker, the wall and the septa. A level 3 cystic mass is going to show very thick walls with irregularities along them and demonstrable enhancement. And then the level 4 is going to be more of a complex cyst in which we see very thick septa and thick irregular walls, but now we also have some solid components within the cyst. So here we have the visual representation then of the Bosniak classification of renal cysts. We can see that number 1 is just a normal cystic structure, very simple in appearance, thin walls, anechoic through transmission. Most of these are going to be malignant. Going to level 2 then, we're going to start to see those thin septa, maybe some small calcifications. Level 2F then introduces more septations, more irregularity to the walls. Level 3 then we start to become significant risk for malignancy. We start to see very thick septa, very irregular walls. And then our level 4 on the Bosniak scale is almost 100% malignant. We have solid components, very irregular walls, very thick septa, calcifications running throughout. Now, what does the Bosniak classification system mean to you? As a sonographer, you're going to be showing the radiologist what you see. And as you scan through the kidney, if you come across a simple anechoic cyst, show that to the radiologist. If you see septa, you got to show them that septa because that's going to change the outcome for the patient. Simple cysts usually are not followed up. They're documented, mentioned, and that's kind of the end of it. When we start to introduce level 2, 3, 4, we need to do something more with it. So maybe they need follow-up in 6 months. Maybe they need follow-up in a year. Maybe they need a biopsy or another imaging modality. So it's important to know what the radiologist is looking for to increase suspicion of malignancy, and then that we go ahead and show them when we see that. And that brings us to the end of part 2, evaluating renal masses. Next up, we have renal cystic disease, where we can put some of our Bosniak classification of renal cyst knowledge to work.